So, the choice of hormone replacement in female for perimenopausal, postmenopausal symptoms and dysfunctional uterine bleeding can be a bit confusing. So, how do you decide whether you give OCPs, estrogen only pill, or progesterone only pill? So, it depends on the patient's status and their symptoms and their main concern. So the first thing to look for is whether they have a uterus or not. Suppose if the patient has already underwent hysterectomy and they don't have uterus, you don't have to worry about the unopposed estrogen action, which leads to endometrial hyperplasia and further leads to endometrial carcinoma. So if no uterus, you can give estrogen alone. There is no worry about this thing. Then you look at their symptoms. So progestin only has given mainly in a cyclical progestin for a perimenopausal symptoms. They can mimic normal menstruation because they can induce withdrawal bleeding. Once you withdraw the drug, once you stop the drug, the bleeding can happen within 3 to 5 days, and it can mimic normal menstrual cycle until the patient actually goes into menopause. Estrogen only pill is for postmenopausal lady who do not have a uterus. So your main concern is to suppress their symptoms, which is mainly due to low estrogen, which is dry vagina, dyspareunia, low libido, and hot flashes. So you give estrogen for a postmenopausal lady. Also, low estrogen can predispose to osteoporosis also. So for those symptoms, you give in a postmenopausal lady, you can give estrogen only. Also, if they do not have a uterus. Otherwise, there is a risk of unopposed estrogen action leading to endometrial hyperplasia. Now, OCPs, as the name suggests, it's oral contraceptive pill. Its main action is contraception, mainly by suppressing ovulation because by negative feedback due to increased estrogen, it reduces the LH. With no LH, there is no ovulation. With no ovulation, there is no ovum for fertilization. It can also increase the cervical mucosal thickening and endometrium can become. It can make the endometrium unfavorable for implantation if at all the sperm ascend up to the endometrium. So these are the mechanism by which OCPs act. OCP, if you are using perfectly, like you are not skipping it any day, you're taking it at the same time, there are no drug interactions, then there is a very low failure rate of 0.3% per year. But otherwise, for a typical use, that is you're forgetting some days to take, you're not taking at the regular timings, it has a bit higher rate, up to 7%. It can also be used for dysfunctional uterine bleeding. The problem with OCP is that it can increase the risk of breast cancer. So, in a lady who already has a history of breast cancer, you avoid using OCPs, but it reduces the endometrial and ovarian cancers in females. So, that's all. Thank you about all the hormonal replacement in a lady for perimenopausal and postmenopausal and dysfunctional uterine bleeding. Thank you so much.